Good evening, everyone. Welcome to the Brand webinar for the month of July. Thank you very much for joining in. As you're joining in, please put in the chat your name and where you're joining in from. Would like to know and meet as many of us on the call. Thank you very much. Oh, I see Elizabeth from Lagos. Thank you. Let's keep it coming in. I see more and more people are joining in. Jessica from Lagos. Wow, thank you. If you know someone who should be on this call, please reach out to them and tell them that we're about to start. We have our lead navigator on the brand program here with us, and there's a lot that she has to share with us. Okay, so we're going to be starting right now. Thank you to those on the call, and if you know someone who should be here, please share the link. Please share the link with them so they can join in. So I will now be handing over to my colleague, Elizabeth, so that she can ask us some questions. Over to you, Elizabeth.
Thank you, Modupe. Good evening, everyone. How has been your weekend so far? So we're going to the icebreaker question just to lighten the mood. So the first question I'll be asking, you can please state your answers in the chat box. So the first question is, do you have a favorite quote that inspires you? Do you have a favorite quote that inspires you? I think I'll start with mine. A quote that inspires me is from Nelson Mandela. It says, "It always seems impossible until it is done." It always seems impossible until it is done. So I would be waiting for us to also type our responses on the chat box. Thank you, Aminat. Like, just do it. Very interesting. Any other person? Okay, I'll give 1 more minute before we go to the next question. Okay, so let's go to the next question if we don't have any other answers. So the second question is, what do you think is the most important thing for breast cancer patients to know when navigating their care? Okay, some answers to the first questions are coming. Deborah, thank you. Joyce Meya, do it afraid. Then Esther, if there is a will, there is a way. Thank you for the beautiful responses, and I'm sure we can all learn and also add this to our go-to quotes. Thank you very much. So to the second question, what do you think is the most important thing for breast cancer patients to know when navigating their care? Any suggestion? What do you think is the most important thing for breast cancer patients to know when navigating their care? That they are not alone. Interesting, yes. And for me, I think what they need to know is access. what the resources and the resources that is available to them. Thank you, Esther. It is not a death sentence. Yes, that is very profound. Breast cancer is not a death sentence. Thank you very much. Any other suggestion or answers? Okay, Modupe, there are options and there is a way out. Yes, there is light at the end of the tunnel. Thank you, Modupe, for that. Thank you. Thank you, Jessica. Never give up. Yes, giving up is not an option. Thank you. Thank you for that. I appreciate everyone for joining and participating in this icebreaker section. I'll be handing over to Modupe. Thank you.
Thank you very much, Elizabeth, for taking us through those questions. So I'll go ahead to introduce our speaker of the evening. Meet Yusuf Abigail, a dedicated patient navigator with a passion for supporting patients through their cancer journey. With over 4 years of hands-on experience, she has helped many patients move past the confusion and fear that often come with a diagnosis. Abigail works closely with each person, offering guidance that's tailored to their needs and helping them find the right care at the right time. As a lead navigator, her work goes beyond hospital walls. She's committed to making sure patients and their families feel seen, heard, and supported. This was shared during the Oncology Care Network webinar titled Empowering Patients Through Navigation, Best Practices and its Role in the Healthcare Sector, where she highlighted the impact of personalized support in breaking down barriers to cancer care and improving quality of life for patients and their loved ones. I present to us this evening Abigail Yusuf, lead navigator on the brand program. Over to you, Abigail.
Good evening, everyone. Thank you, Modupe, for the beautiful warm welcome. And of course, thanks to the team who has made this webinar a success, and thanks to the listeners who has taken their time to join in on the webinar. My name is Yusuf Abigail. I am the lead patient navigator for brands, and I've been a patient navigator for over 4 years. And this journey has been a roller coaster, but I'm very grateful to have impacted so many people's lives. So, and I hope I'll be going right into the session, and I hope to be an engaging one. Please feel free to drop comments or ask questions. So the common questions I get is who is a patient navigator? A patient navigator is someone who helps patients find their way through the healthcare system from diagnosis to treatment, making the process easier and faster and less overwhelming. Okay, there are several ways a patient navigator can help patients find their way through the healthcare system. So I'll be explaining from the diagnosis. So a lot of patients do not understand whatever is written in their diagnostic report, and they need more clarity on it. So it's the patient navigator's duty to give clarity on a patient's diagnostic report, and to also help patients with their treatment plans and scheduling appointments, ensuring timely conversation between the healthcare teams. So a patient navigator is about making sure no one goes through healthcare alone, and these three pillars help guide that support. For pillar one, we have pre-diagnostic interval, early diagnosis, positive clinical assessment, positive screening results, barriers to participation, delays in reaching the healthcare system. So we need to ensure our patients get a positive clinical assessment. We need to ensure the healthcare providers are going through the clinical assessments in a proper manner, in a comfortable manner that will not scare the patient. And for positive screening results, we have to ensure that patients get their results. We have to follow up on the screening results whenever our patients comes for their screening. Barriers to participation. We have so many barriers to participation. It could be transportation. It could be patients don't want to even come for it, or they are not prepared to come for it. So it's the duty of the patient navigator to reassure patients and tell them the advantages of early detection. And of course, early detection saves lives, it saves time, it saves money, and it saves the patient's mental health. And for pillar two, fragmented healthcare coordinating systems. This talks about patient navigator coordinating care among provider and reducing wait time. So it is up to the patient navigator to reach out to the patient's healthcare providers, the consultants, the doctors, to know the best way to help and support the patient through their journey and make them comfortable, make them feel calm, reassure them, and ensure they don't waste their time looking for what they don't know, or they don't know where to go. Sometimes they don't even know what test is to be done. So it is a patient navigator that bridges the gaps amongst that. Coordinating services, it is up to the patient navigator. It's the role of the patient navigator to coordinate the services that the patients are coming for in the clinic, whether it's their consulting appointment, their test appointment, they have series of appointments. So most patients usually get confused on where to start whenever they come into the clinic. They don't know whether to go to the pathologist first, or to go to the oncologist, or to go to the surgeon. So a patient navigator would guide them through, be like, okay, ma'am, you have to go to your pathologist first, which helps the nurses focus more on their healthcare, because the time of which the patient navigator has used to direct the patient on where to go and when to go, and then they'll be able to come back and the nurses will focus more on their healthcare, of course. And we have pillar 3, treatment interval, treatment completion without abandonment. We have to encourage our patients to adhere to their treatment. A lot of patients feel overwhelmed. Some of them do not even like coming into the hospitals, honestly. Once they see the doctor, they see the nurses, they start feeling overwhelmed, they start feeling we can't even express their feelings. We can't even explain them, because we just have to put ourselves in their shoes and, of course, relate properly and engage with them. We have to make them feel warm and welcomed, and make sure that they don't feel alone in their journey. Can you please next slide? The role of a patient navigator. The role of a patient navigator is to help patients move through the healthcare systems without delay. They break down barriers, link patterns to care, and make sure no one gets lost or left behind, whether they are a nurse, social worker, survivor, or community volunteer. Key roles of a patient navigator: to identify and help remove barriers to care, transport, financial issue, or lack of access to service. So when we're talking about lack of access to service, it could mean appointment. There are lots of patients that have long waiting time to see the doctor. They have long days to meet their consultant. So it's the duty of the patient to put the patient navigator to put the patient's interests at heart, and work around the healthcare sector and find a better way to help the patients reach and have access to the health services. And there are lots of patients that might come up with financial issues. So we've come up with link of financial support for the patients to, of course, to go and register for, and try to get financial support. Link patients with health and social services, connect across different levels of care from community to hospital. So for a cancer patient, they don't just get care in one place. They have to go to the diagnostic center, they have to go to the gynecologist, they have to go to the oncologist, they have to go to the surgeons. So we have to connect through their journey and make sure we are not forgetting anything to avoid mistakes, because once a patient starts lagging in any of the levels of care, we start getting issues and setbacks, and we really want to avoid that from happening. Educate and inform patients and communities. Provide clear information on breast health diagnosis, on treatment. Like I said earlier, it's the patient navigator's duty to bring clarity to the patient and their treatment options, on how they can manage side effects, on how they can go to their treatments, go for their consultations, and all sorts. Support screening and early detection efforts. As a patient navigator, it's our duty to advocate. We need to advocate as much as we can, because there's a lot of stigma surrounding cancer. The stigma is just too much. A lot of patients, just once they hear they have cancer, they just believe it's a death wish, it's a death warrant, and they start withdrawing from a lot of things, like how would they come up to the society, how would they show themselves out, and a lot of things. So we advocate for early detection and screening, and we try to, bring our patients in to take advantage of the opportunities and get their screenings done. Facilitate timely diagnostic services. So we help patients schedule their tests, we get their tests from the pathologist, and we try to reduce delays in diagnosis. We have to prioritize our patient session, because sometimes when a patient is asked to do tests, the period of which they get the test and they need to give it to the consultant usually they just lag with each other, and we try to bridge gaps. So once we know that, okay, this patient is going for this test, it's our duty to follow up with the pathologist that, hello, please, how was the follow-up on our patient's report? How can we get it faster? Is there anything else we can do to assist? So we have to go through that pattern. So provide emotional and social support. Offer a listening ear, guidance, and connections to peer support. Of course, we have to make our patients feel like they are not alone. We have to reassure them that in this journey, there are other peer supports that are also around to comfort them, to make them know that they are not experiencing this alone. So we have support groups that we engage our patients in. We create webinars. We ask our patients questions. We listen to their feedbacks, and from there we organize webinars that tailor to their concerns. Coordinate treatment and appointments. Help patients navigate surgery, chemotherapy, and other care steps. So for other navigations through the surgery, we have to meet with their surgeons, speak on the next steps of the patient. Is it the post-op, the pre-op? We have to talk to the surgeons on how it's going to be and how their sessions are, so that we can, of course, encourage the patients and follow up and help them manage their pains. Support adherence to treatment, counsel patients, explain processes, and address side effects. A lot of patients avoid chemotherapy majorly because of the side effects, because there are a lot of side effects that comes with chemotherapy. So one of the side effects is they have diarrhea, they can have bloating, and patients do not like any, they already know they have cancer. So all these little things adding to their emotional and mental health, it's just, overwhelms them. So we have to help them manage their side effects and reach out to their consultants on how best they can manage their side effects. Follow up and monitor progress. We have to ensure our patients attend appointments and receive the needed care. Improve quality of life during and after treatment. Okay, now, so quality of life is very, very important, because it helps the patients be able to go back to their daily activities. A lot of patients, once they realize they have cancer, they withdraw from their daily activities, they stop relating with anyone, they withdraw from families, they withdraw from relationships. They can't even keep up with their physical activities. So we have to ensure proper quality of life management, help them manage their symptoms, reduce stress and anxiety, and of course, help them maintain their relationships and their social connections. So Brands. Okay, so Brands is a program by Uncle Paddy and Brooch, and we recently launched, and I'll be using this program as an example and to explain how a patient navigator helps a patient through the journey. But first, what is Brands? Grant is the Breast Cancer Access Navigation and Testing Program, which is to help 5,000 newly diagnosed breast cancer patients access timely immunohistochemistry and supportive care. And I know you want to ask me, what is immunochemistry and supportive care? So immunohistochemistry is one of the tests that is required for a patient to do to guide a surgeon on knowing the kind of chemotherapy patients will take. And mind you, there are lots of patients that have skipped immunohistochemistry and just gone into chemotherapy straight up. Now, after 3 months or 3 sessions in, 6 sessions in the chemotherapy is failing, or because the patient didn't do immunohistochemistry and surgeon just gave the chemotherapy that would just address the concerns for that moment, and the whole thing fails. So after paying a huge sum of amount for chemotherapy, you now have to just go and start again, do immunohistochemistry before you can now know the right chemotherapy to take. So we are trying to lift the financial burden and support our patients through their journey. So we don't want patients skipping immunohistochemistry. That's why we brought this program. And there's a lot of benefits that comes with this program, apart from the ones listed on the screen. We have free consultation with the dietitian, the psychologist, and of course, doctors. They have access to doctors, access to financial support links, access to support groups and webinars, and of course, educational resources, because we've curated videos, we've created educational materials for patients to use to guide them in their cancer journey. So for this program, there are certain criteria that we need for this program. One of the major criteria is the histology reports, and the patients must be a newly diagnosed and must have not done immunohistochemistry before. So once we get the patient's diagnostic reports, then we check, okay, is this patient, does she meet the criteria for the program? Then we have a series of questions for follow-up. Have you done immunohistochemistry before? So what's the next step, and series of other questions like that before we now bring the patients on board. So next slide, please. All right, so I'll be using a patient to explain the journey on this grant program, which is focusing, of course, only on the immunohistochemistry. So meet Miss Felicia. A patient went for a random breast screening at Lagos State University Teaching Hospital, Lasut in Lagos. When she found a lump in her breast, she was asked to do a follow-up biopsy when she found out she has breast cancer. Afterwards, she needed to do more tests and was referred to the breast oncology clinic in Lasut. One of the tests she was asked to do was immunohistochemistry testing. And of course, when we launched the program, we did a lot of advocacy, a lot of PR, and we got ourselves engaged with some of the hospitals in Lagos, and Lasut is one of them. So the oncologist, having known about the financial issue of the patients and knowing of the program, and we are doing the immunohistochemistry for free for all newly diagnosed breast cancer patients, decided to introduce her to the program. And from the point of diagnosis, the patients were still feeling lost and confused, even to the point of seeing the doctor, even after the doctor has given her a detailed explanation on what it's going to be, how our cancer journey would be like. Nobody wants to hear they have cancer today and we have peace of mind. Nobody even would think that. The first thing the patient thinks is that, will I survive this cancer? Is this a death wish? Is this what's going to be? What will happen to my life from now on? So after the doctor has already referred her to the program, of course, a patient navigator was assigned to her. And after several engagements and discussion back and forth, see, there's a lot of things you can tell to a newly diagnosed cancer patient right now, and they will not even listen. They will want to start asking you that, nurse, how is this cancer like? What will happen now? What will happen to me? How much will I spend? They ask series of questions, and one of the common questions they ask is, will I be able to survive breast cancer? Next slide, please. So after we've reassured the patients on their breast cancer journey, and we try to encourage them, to fight and always keep a fighting spirit and be calm. Everything is going to be fine. We try to make them at peace. We try to do our best to support them emotionally, just to assist their mental health, of course. Then we move on to onboarding the patients on the grants program. Like I said, after the patient's engagements with the navigator, the patients enrolls on the platform. There's usually a link for the platform that patients will enroll on, and the patients watches resources. Like I said, we have educational resources on the platform. We have videos curated and tailored to cancer concerns from the patients. So after we've done all that and we go to the consultation, we have a breast clinic consultation. Patients get free consultation with the dietitian and the psychologist and the doctors for free. So once they come in and they have a consultation with the doctors and everything, we move to their IEC request and collection and testing. So once we have onboarded the patients, we start making plans on how to get their sample and do the test for the patient, so which is the IEC test. So once we've done all the testing, we've done everything, it is the patient's navigator's duty to follow up once they followed up on the test, okay, as this sample got into the collation center, as the tissue block being tested, when we will be getting the results, because it takes 2 weeks to get the results. So we have to keep tabs so that the patient can start their chemotherapy session very early. So then whenever the test gets released, we upload the test result and we send them to our patients and we communicate with their doctors. So, okay, please, this patient's test result is out. Kindly reach out to her so that she can start a chemotherapy session. And we have the MDT session, which is the multidisciplinary team that comprises of surgeons, doctors, oncologists that come together to talk to the patients and make informed decisions on the next steps of the patient. They make decisions on their treatment plans. They make decisions on what next steps the patients can take, which is also for free. So after all this has been done, the program reports, we give a detailed report on everything that has been done with the patient so far, and the patient officially closes out on the program. So like I said, this program is based on the immunohistochemistry alone. And so it's not really going fully into the on-site hospital management, and also because we are focusing on the grant program. So this is what the website page looks like for the grant program. So whenever a patient wants to like sign up, they want to start their grant journey, this is where the links brings them to once they click on the link. Next slide, please. All right, so that comes to the end of my introduction to a dedicated navigator. And of course, please drop your questions. I'm open to any questions and comments. We're here to learn from each other. So thank you, Modupe. So I'll be handing over to Modupe, of course.
Thank you very much, Abigail, for that amazing introduction to patient navigation. For those who just joined in, welcome. So we're going into the question and answer session. I'll be handing over to my colleague, Deborah, to take on the Q&A.
Hi, good evening, Modupe. Thank you for handing over to me, and thank you, Abigail, for that beautiful presentation and introduction to patient navigation. And I believe we've learned a lot, and our audience tonight have really learned so much from your experience and from your lecture on how to be a patient navigator. So please drop your questions in the chat box, or you can use the Q&A feature to drop your questions. So going right into it, I have some few questions here, and I would love to ask these questions. And number one is, what are some challenges that a new patient navigator can encounter when just coming into the field for the first time? What are some challenges that, okay, yeah, maybe from your experience, what were some challenges that you were like, oh wow, I never knew this was in this field? Yeah, Abigail, over to you.
Sorry,
Yeah,
Deborah,
am I
please
audible?
kindly repeat
Okay.
that question. I didn't get you.
All right. So the question is, what are some of the challenges you faced? Maybe just to advise someone that is coming into the field newly, what challenges do you think they would face, maybe with their patients or with healthcare providers? Because you were speaking on, what you taught us was that you act, a patient navigator act as an intermediary between the patient and the healthcare team. So, and they get all the they expedite the process for tests and reports, so that the patients will be comfortable and be rest assured. So what was one challenge that is when you started out on your journey?
Thank you for the wonderful question, Deborah. So one of the major challenges I've had so far in my journey, number one, is the language barrier. So most of the time, once when we want to talk to a patient, once we start speaking big grammar, they start looking at us like, what's this lady even saying? Someone that is already feeling overwhelmed and you're still speaking big English, you start looking at you like, and somebody that wants to avoid the doctor's English, you're also coming as a patient navigator to start speaking English. You have to just go down to their level of understanding and language, even if it has to be in Pidgin or their local language like Yoruba. You try to communicate and make them feel like, okay, I'm your next neighbor that you are gisting with, I'm your next sister that you're talking to. So we try to reduce the language barriers. And one of the other barriers is there are so many complex healthcare systems that we just have to go through on field. One of the places we get issues with is either with the pathologist or with the doctor complying to, our follow-up. Once you call doctors, sometimes they won't pick up your calls. You have to chase them morning and night before you can even get a response from them. You want updates from your patients, and doctors are always busy, as we all know. So we have to keep tabs on doctors back to back, and the same thing for patients also. Once you're trying to bring patients into the healthcare sector, they just try to run away from it. They don't like the hospitals, they do not. So we have to continue to encourage them and help them fight and walk along their journey. Thank you.
Okay, yes, thank you so much for the second barrier that you just talked about. Because it's leading me to my second question, which is I know getting a doctor to attend to something sometimes there may be this barrier because one, doctors are kind of overwhelmed, and well, particularly in the field of oncology, we have less of healthcare professionals in this field. So, and with the numbers that we have, we're overwhelmed, and I know that's why the patient navigators, they play this heavy role. They are wonderful people. They are wonderful souls. They play this role in trying to connect all the dots together while keeping everybody sane. So when you are having a challenge with maybe getting a report, or getting a feedback from maybe a patient or a doctor, and you are not getting it, what should a patient navigator, what is the next mode of action, what should he or she do, so as to still keep the communication flowing, still keep the whole system running? Yeah.
All right, thank you for that question. So one of the major trick I do is to just, reach out to the next intermediary. So doctors have people that they take their calls easily when they see them. So you have to also know those people. It's inevitable. You have to know those people because once a doctor sees your message, they want to avoid you too. So but there are some people in their group that they don't avoid for sure.
Yeah.
So whether it's the surgeon, the consultant, the physician, that's why I say we have to walk through all those steps and journey alongside the patient. So we can know at least if the doctor doesn't want to communicate with the patient directly, they must have communicated to the surgeon or the pathologist. So once the doctor is not responding to me, I am going to the pathologist. Once I'm talking to the pathologist, I get no response, I am going to the surgeon. From the surgeon, I am going back to the doctor. So once I've gone through all sides to get him, he doesn't have a choice but to comply. He will definitely respond. So that's one of the things I.
Yes, thank you so much for that beautiful answer. I mean, that is just the best. A navigator should have a rich network of, specialists, a rich network of people you can easily call, or people that when you call them, they would answer. So it's one of the spec of this profession, right?
Thank you very much, Deborah, for the questions that you asked. And thank you very much to Abigail for the answers that you shared. I believe that everyone who joined this webinar has learned a lot about patient navigation and about what is the next step what is the next step in regards to patient navigation. So thank you so much, everyone. Please be reminded that we have brand webinar every month. So do look out for the next webinar that will be taking. We'll inform you, and you would get the opportunity to join our next webinar. And please follow us on our social media platforms on Instagram and on LinkedIn. On Instagram is at Uncle Paddy app. On LinkedIn is Uncle Paddy Tech. Please follow us, share our posts, and let others know about our programs. And most importantly, if you know a woman newly diagnosed with breast cancer who needs to do immunohistochemistry testing, tell her about the brand program and you're saving her life. Thank you so much, everyone, and do have a lovely evening and a great week ahead. Thank you.
All right. I want to thank everyone for joining today's webinar. I hope that we all have been enlightened, and we hope to see you on the next. Thank you very much.
Thank you very much, everyone. If you're still on the call, do check the links in the chat. Do click on them as you leave the room. Thank you so much, everyone. Do click on the links in the chat. Thank you very much, everyone. Thank you very much, everyone, for joining in. If you're still on the call, do check the chat. We've dropped the link for you to learn more about the brand program, and you can also share this link with people that you know need it. Thank you so much, everyone, for joining.